Okay, so let's talk about an illness that for most people is really no big deal, kind of like a common cold. But hiding just beneath that mild surface is a danger so serious it can change lives forever. We're going to unpack the story of rubella, and you'll see exactly why this seemingly minor virus demands our full attention.
And this slide right here gets to the heart of it. This is the whole paradox of rubella. For a child, it's a minor inconvenience at worst. But for an unborn baby in the early stages of pregnancy, the consequences can be absolutely catastrophic. We're talking blindness, deafness, serious heart defects. It's a shocking contrast, and it's why we have to understand this virus. It really is a tale of two completely different illnesses, all wrapped up in one.
So now that we know just how high the stakes are, let's dive in and get to know the virus itself. What exactly is German measles, and how does it work? Well, rubella, which you've probably heard called German measles, is caused by, you guessed it, the rubella virus. The name is pretty straightforward. It comes from the German doctors who first described the illness. But the single most critical thing to remember, the absolute takeaway, is that while it's usually super mild, everything changes if it's contracted by a woman during those first 3 months of pregnancy. So what would you actually feel if you caught it? Well, the symptoms are pretty standard stuff for a mild virus. You'd probably feel a bit under the weather, maybe a slight fever, a runny nose, and one of the classic signs is swollen glands, especially behind your ears and in your neck. Then, after that, comes this reddish-pink rash that usually starts on your face and then spreads down your body. The whole timeline of the illness is actually pretty distinct. After you're exposed, there's this surprisingly long incubation period. We're talking 2 to 3 weeks where you feel totally fine, no idea you're even sick. Then those mild symptoms kick in, the rash shows up about a day later, and then, within just a few days, it's all over. For most people, it's really quick and pretty uneventful.
But here's the kicker. This is the fact that makes the virus so sneaky and so dangerous. A full 1 in 4 people, 1/4, who get rubella show no symptoms at all. They can carry it, they can spread it to others, and they never even knew they were sick. This silent transmission, that's what makes rubella so incredibly hard to contain.
So, how does it get around? Well, it's exactly how you'd expect a virus like this to spread. It's through tiny droplets from coughs, sneezes, even just from talking. It's a simple and very effective way for the virus to travel, which makes it really tough to avoid if you aren't protected.
Now, while the biggest risk by far is to an unborn baby, there are a couple of other complications to know about. Adults who catch rubella, for instance, can sometimes get temporary arthritis, with stiff, swollen joints. And then there's a very, very rare complication, about 1 in 5,000 cases, where it can cause encephalitis, which is a dangerous inflammation of the brain.
Okay, so knowing all of that, let's get practical. What are the actual steps you should take if you or your child gets sick and you think it might be rubella? The guidance here is really clear, and it's all about protecting the community. Obviously, you'd get immediate medical help for anything severe like a convulsion. But after that, the priority completely shifts to protecting others. You notify the school, and this is absolutely critical. You have to inform any pregnant women who might have been exposed. And that last piece of advice, to call the doctor's office before you go in, that's so important. It stops you from accidentally putting someone vulnerable at risk in the waiting room. When it comes to treatment, there's actually no specific medicine for rubella. It's a virus, so you pretty much just have to ride it out with rest and maybe some paracetamol for the fever. In the community, though, the response is all about containment. A child with rubella will be kept out of school for at least 5 days after the rash starts, just to stop it from spreading any further. So this brings us to the biggest and most important question of all. We've got this mild illness that is secretly carrying a massive risk. So how do we stop it? How do we finally break the chain and protect the people who are most vulnerable? Well, thankfully, the answer isn't just about managing outbreaks when they happen. We actually have a way to prevent them entirely. We can build a definitive shield. And that shield is vaccination. The strategy is really smart and multi-layered. In places like Australia, for example, kids get vaccinated at 12 months old, and then they get a booster before they start school. It's also recommended for all women before puberty. And here's the really crucial part. For anyone thinking about starting a family, any woman who isn't immune should get vaccinated at least 3 months before trying to get pregnant. And the results of this strategy have been amazing, with most women in that key age range now being immune. But, and this is so important, You can't just assume you're protected. The only way to know for sure if you have that immunity is to get a specific blood test from your doctor.
So it really all comes down to this. We have a disease that can cause lifelong disabilities, but it is completely preventable. Its mild symptoms are basically a disguise for its true danger, which makes protecting our entire community an essential responsibility. We have the tools, we have the science to eliminate this threat. The only real question left is, are we using them to make sure everyone is safe?